Well, hello, everybody. It's nice that you're with us. The four of us have come to you today to speak to you about the study abroad programs that we are offering in healthcare and in nursing for 2022 and 2023. I'm Sotos Chavanis, and I am joined by Desiree Diaz, Mindy Anderson, and Sandra Galura. We're coming to speak to you on behalf of Dr. Galura and I, UCF in Mexico, International Perspectives of Nursing and Healthcare, and Drs. Anderson and Diaz will be speaking on UCF in the Bahamas and the simulation-related study abroad. International Perspectives of Nursing and Healthcare in Mexico. And so I am Sotos Chavanis, and I am acute care nurse background in working with adults and trauma patients. And I've actually lived in Mexico in my prior career. Very excited to be going on this study abroad. And I'll let Dr. Galura briefly introduce herself.
Hi, everybody. Dr. Galura here. I don't have much contact with you during your undergrad programs. I teach in the graduate programs, but have been on about 9 international mission trips providing primary care and surgical care to patients in both Central and South America. So I'm looking forward to leading this trip with Dr. Giovannis.
And so our study abroad in Mexico in nursing and healthcare will provide an opportunity for students to explore the healthcare system in Mexico and Latin America in general. We will be working with patients in indigenous communities, learning about their culture and their lifestyle as it relates to the people in the area of Chiapas, in the state of Chiapas, centered around the cities of Tuxtla Gutierrez, San Cristobal. Our partners in Mexico will be the Autonomous University of Chiapas, the Medical School of Tuxtla Gutierrez, and the English Language School in Chiapas, in addition to the Corazon de Maria Catholic School, who is the home and the trainers of many of the parteras in Mexico, who are traditional birthing midwives in the area of southern Mexico where we'll travel. We'll study themes, read about issues, and reflect on social and historical topics that are relevant to this country of Mexico, and specifically the southern and Maya region of the country. We'll organize service projects to be implemented within the country, and again, in partnership with our partners in the medical school and in the parteras and the midwife group there.
Thanks. So again, just to recap our learning objectives for the course, we'll be looking at the healthcare systems in comparison with those in the United States. We'll look at the strengths and weaknesses of both the systems. We'll look at aspects of Mexican culture and the social and political history that has influences on healthcare, especially around indigenous populations and marginalized populations. And we'll explain the impact of the different systems on the practice of nursing and its health and the health of its citizens, including the access to their care. So the course structure, to participate in this particular study abroad program, you would enroll in the course for spring. Our didactic component of the course does not start till after spring break. So you will enroll for a spring semester and not have classes start until after spring break. Our travel date to Mexico is confirmed as May 27th to June 4th. So we do travel after spring semester is over, right at the very beginning of summer A, but you do not register for summer A. The mode of instruction for our course is a mixed mode. It consists of web course, Zoom interactions. We will be having some interactions and connections with students at the Autonomous University of Chiapas and the English Language School prior to travel. So for the purpose of planning our service learning activities. You will have a couple of face-to-face meetings with Dr. Giovannis and I once we get everybody's schedules collated and can look for some optimum times. And we'll have some pre-travel meetings where we will meet Celia Velez, who is our in-country host and guide for our travel time. We will be accepting a maximum of 12 students that can be at the graduate, undergraduate, pre-nursing level of enrollment, as well as opening it up to other disciplines, however, prioritizing nursing students first. The itinerary, we will be traveling to Tuxtla Gutierrez first and spending a day there with the students at the medical school in their clinic that they run for the city. We will also be spending some time with English language students in Chiapas. As Dr. Giovannis noted earlier, our service learning opportunities will probably include some time at the Corazon de Maria School, which is a school in the rural area of Chiapas, an elementary school. And then we will have some cultural excursions to some Mayan ruins and different indigenous cultural sites in the southern Mexico region and state of Chiapas.